What if your heart could send you a text message, a warning signal, right before something big goes wrong? Well, in a way it can. Today we're going to talk about angina, and we're going to look at it not just as a symptom, but as a really important message from your body's most vital engine.
So have you ever had that feeling, that squeezing, heavy pressure in your chest, maybe during a really stressful day, or when you're pushing it at the gym? It's a feeling that's pretty hard to ignore, right? Well, let's dive in and decode what your body might be trying to tell you.
All right, so first things first, we need to reframe how we even think about this. Angina, it isn't really a disease in and of itself. Think of it more like a warning signal, a message coming straight from your heart. And it's all about a simple, fundamental problem: supply and demand.
Okay, you're going to see this term myocardial ischemia. I know, it sounds super technical, but the idea behind it is actually pretty straightforward. Just picture your heart muscle as this hard-working factory. And like any factory, it needs a constant supply of fuel to keep running. In this case, that fuel is oxygen-rich blood. So ischemia is just the fancy word for what happens when the demand for fuel is way higher than the supply. The factory is running low, and that discomfort, that squeezing feeling, that's the alarm bell going off.
Okay, so your heart is sending a signal. Got it. And this is the really critical part, not all signals are created equal. They don't all mean the same thing. So how do you tell the difference between a kind of predictable warning and a get to the hospital now emergency? Let's break it down.
And this chart lays it out perfectly. On one side, you've got stable angina. This is the predictable kind. It follows a pattern. It pops up when you're exerting yourself, lasts for maybe 5 minutes or less, and it goes away when you rest or take nitroglycerin. It's a warning for sure. But then you look at the other side, unstable angina. This is a whole different ballgame. It's unpredictable, it can hit you even when you're just sitting on the couch. It lasts way longer, and rest doesn't really help. Here's the bottom line. Unstable angina is a type of acute coronary syndrome, and that means it is a medical emergency. Full stop. You need to get to a hospital immediately.
Now, it's not always that classic movie scene chest-clutching pain. And this is so important to know. For some people, especially women, folks with diabetes, and older adults, the heart's warning signal can be way more subtle. It might feel like just extreme out-of-nowhere fatigue, or nausea, or just intense sweating. The medical term is diaphoresis. Recognizing these atypical signs is absolutely vital.
So, that brings up a really good question. What actually sets off this whole supply and demand problem in the first place? Let's take a look at some of the common triggers and risk factors that can either bring on an angina episode or just make it worse.
And what's interesting here is the mix of things on this list. You've got your everyday triggers, right? Like emotional stress from a tough meeting, or physical stress from a workout, or even something as simple as walking out into cold weather. Then you've got stuff that's more tied to lifestyle, obesity, alcohol, stimulants. And of course, there are some risk factors you just can't change, like your age or gender. The key is really knowing which of these might be in play for you. Okay, so now for the good news. Since this is all a supply and demand problem, the solution is, well, to fix the balance. And that is exactly what the Anti-Angina Cool Kit is all about. It's designed to do one main thing: ease the burden on the heart. When we look at the main medications used to tackle angina, they basically fall into 3 big categories. You've got beta blockers, calcium channel blockers, or CCBs, and then the biggest piece of the pie here, nitrates. And for our purposes today, we're really going to focus in on nitrates because they are such a cornerstone of treatment.
So what on earth is a venodilator? It sounds complicated, but it's not. It just means it dilates or widens your veins. That's it. Think about it like this. Your heart is a pump trying to push blood through a series of hoses. If those hoses are narrow, the pump has to work really, really hard. Nitrates basically make those hoses wider, so the pump doesn't have to work as hard. That reduces what's called cardiac preload, basically the strain on the heart. And that lowers the heart's need for oxygen. Boom! We're helping to balance that supply and demand equation. So how does this actually happen inside your body? It's a pretty cool little chain reaction. First, the nitrate gets into the smooth muscle cells in your blood vessels. Inside, it gets converted into something called nitric oxide. This nitric oxide then kicks off another process that basically tells the muscle, hey, chill out, relax. And when that muscle relaxes, the blood vessel gets wider. And just like that, blood can flow more easily and the heart gets a much-needed break. It's a really elegant biological fix for a mechanical problem.
Okay, here's a huge pro tip for safety. You have to remember this one. Because nitrates are so good at widening your blood vessels, they can sometimes cause a pretty quick drop in your blood pressure. And what happens then? You might get dizzy or even faint. So the rule is simple, and it's non-negotiable. If you're taking a sublingual nitrate, that's the little pill that goes under your tongue, always, always sit down first.
Okay, we've covered a ton. What angina is, what triggers it, how we can treat it. But now we have to talk about something you should never do. This next part is about one of the most critical, dangerous drug interactions out there, especially if you're taking nitrates. So please listen up.
So take a look at these two types of drugs. On the one hand, we have organic nitrates, like nitroglycerin, which we've been talking about. On the other, we have something called PDE5 inhibitors. You might know them as medications for erectile dysfunction. Now, look at what they do. Nitrates widen blood vessels. PDE5 inhibitors widen blood vessels. See the problem? They're both doing the same job, and that overlap is exactly where things get dangerous.
And this is precisely why it's so incredibly dangerous. Taking both of these at the same time, it's like putting your foot on the gas pedal twice for the same effect. The result gets amplified, leading to a massive, severe, and frankly dangerous drop in blood pressure. We're talking severe hypotension. This isn't just a minor side effect. This can be absolutely life-threatening.
So how do you avoid this? It all comes down to timing. The number you need to remember for short-acting PDE5 inhibitors is 24. 24 hours. You must wait a full 24 hours after taking one of those before you can safely take a nitrate. That one-day window is not a suggestion. It's a critical safety rule.
And for the long-acting versions, that safety window doubles. The number to remember here is 48. 48 hours. You have to wait 2 full days. So please, burn these numbers into your brain, 24 and 48 hours. They are absolutely critical safety protocols designed to prevent a truly life-threatening situation.
Look, the final word on this from the entire medical community is absolute contraindication. When you hear that phrase in medicine, it doesn't get any more serious. It means do not do this ever. It's forbidden, period. The risk is simply way, way too high.
All right, let's zoom out and recap the big takeaways here. Number 1, angina is your heart's warning signal. It's an alarm bell. Number 2, you absolutely have to know the difference between stable and unstable. One is a warning, the other is an emergency. 3, know your triggers. 4, the goal of medication is just to ease your heart's workload. And finally, the big one, never, ever, ever combine nitrates with PDE5 inhibitors.
You know, when you boil it all down, all of this information points to one simple, powerful idea. Your body, and especially your heart, is talking to you all the time. It sends you little signals, little whispers when things are okay, and it sends loud, blaring alarms when they're not. So I'll just leave you with this one question to think about. Your heart is sending out signals. The real question is, are we listening?